Hello, everyone. Hello, and welcome to OHA's Public Health Equity Grant Request for Grant Application Informational Session. We are so glad you're here. My name is Jacilia Johnson. I'm one of the program managers in the Equity Office. Next slide, please. Before we continue, we would like to start with some Zoom webinar tips. This meeting has captioning and live interpretation available. For closed captions, please click the CC button on the bottom of your screen. This is a bilingual meeting. Please select your language of choice by selecting the More button with the three dots, selecting the interpretation icon with the globe, and selecting either English or Spanish. Instructions will be dropped in the chat. This webinar is being recorded and will be posted to the application website. Please mute your mic and feel free to utilize the chat function. We'll have a Q&A session at the end, so we encourage you to hold questions as we may cover the answers as we go along. Next slide, please. Once again, welcome, community-based organizations. We are so happy you're here. Please feel free to introduce yourselves in the chat with your name and pronouns, your organization, and just for fun, what county are you joining us from today? Next slide, please. All right. We're going to, as you all are introducing yourselves, we'll start with our agenda for today. First, we'll start with sharing who we are within OHA, and then we'll talk about the Public Health Equity Grant funding opportunity and who can apply. Next slide, please. We'll also introduce the programs collaborating for this grant, the funding categories and eligible activities. We'll talk about requirements and show the application landing page. We'll share resources and important dates. And lastly, we'll open up the Q&A portion of the presentation. Next slide. All right, we'd like to share OHA's commitment to community. So we acknowledge that there are institutional, systemic, and structural barriers that perpetuate inequity. These barriers have silenced the voices of communities over time. Oregon Health Authority is committed to partnerships, co-creation, and co-ownership of solutions with communities disproportionately affected by health issues. We recognize community engaged health improvement is a long-term and adapting process. And we are striving to engage with communities through deliberate, structured, emerging, and best practice processes. We are striving to make engagement with public health effective for communities, especially those communities that experience institutional, systemic, and structural barriers. Through this grant, we are looking for long-term relationships with the community. Next slide, please. All right, so in this slide, you can see all the divisions within Oregon Health Authority. Perhaps you have worked with some under a different grant opportunity. We are the Public Health Division, which is highlighted in yellow. Next slide, please. Within the Public Health Division, we have three centers and the Office of the State Public Health Director. All three centers, along with the Office of the State Public Health Director, are engaged in a unique cross-sector collaboration for this grant opportunity. And I'll pass the mic to my colleague Allison for the next slide.
Thanks, Jucilia. Hi, everyone. My name is Allison Varga. I am a Community Engagement Coordinator in the Equity Office, and I'll be sharing a little bit more about the Public Health Equity Grant. Next slide, please. We'll start by centering on what the overview and purpose of this grant is. Oregon's state goal to improve healthcare access to all by addressing barriers in systems that make it hard for communities to stay healthy. We recognize that achieving this requires a multifaceted approach, with community-based organizations playing a critical role. By offering community-led and culturally relevant services built on trust and strong relationships, CBOs are an important part of Oregon's public health ecosystem. Next slide, please. Priority populations for this grant are communities that experience health inequities, including communities of color, tribal communities, disabilities communities, immigrant and refugee communities, undocumented communities, migrant and seasonal farm workers, LGBTQIA plus communities, faith communities, older adults, rural communities, houseless communities, and others. So, who is eligible to apply for this grant? Next slide. We are accepting applications from 501c3 organizations, 501c3 in partnership or coalition of organizations, nonprofits with 501c3 fiscal sponsor, and federally qualified health centers or FQHCs. If you are a current public health equity grant recipient, you must reapply and be selected in order to receive funding beyond December of this year. Who does not qualify? Entities that don't qualify for this grant include health systems, for-profit organizations, LPHAs or organizations contracted by LPHAs that fulfill LPHA responsibilities outlined in this administrative rule, and education service districts or ESDs and school districts. Next slide, please. Now we'll dive into the available funding categories for this round. Next slide. There are 10 funding categories available to apply for, starting with communicable disease prevention, for which there are 2 subcategories: prevention of HIV, sexually transmitted infections, and tuberculosis, and immunizations. Next slide. Other categories include commercial tobacco prevention, overdose prevention, and adolescent and school health. Next slide. Environmental public health, preventing environmental exposures for children, also known as PEACH, and lower Umatilla Basin groundwater management area, also known as LUGWAMA/domestic wells. And lastly, community resilience with 2 subcategories: community connection and empowerment, and emergency preparedness and response. And for the next slide, I will pass it over to the first program to introduce themselves. Take it away.
Hi. Thank you. Good afternoon, everyone. Thanks for being here. My name is Jillian Garai. I'm with the HIV, STD, and tuberculosis section with the Oregon Health Authority. Next slide, please. All right, in Oregon, we are focused on ending new transmissions of HIV, sexually transmitted infections, or STIs, and tuberculosis, TB, by using a syndemic lens. A syndemic is a set of linked health problems involving 2 or more conditions. These conditions interact to create an excess burden of disease in a population. Examples of these include poverty, housing instability, racism, stigma and discrimination, and criminal justice involvement. Many communities in Oregon experience an excess burden of disease for these reasons. We cannot end HIV, STI, and TB transmission without ending inequities. Community is a theme woven throughout our work through community partnerships, shifting resources to community, and supporting community-led needs assessments, education, outreach, and response efforts. The Oregon HIV, STD, and TB section works closely with many community partners to ensure people with these conditions and their contacts receive appropriate treatment and care, including connections to other needed services. We also educate providers and the public on these conditions and assist in developing public policy related to prevention and care for impacted communities. We have a funding range of $50,000 to $400,000 per CBO for this work and are looking to fund approximately 10 organizations. Next slide, please. For this grant opportunity, the Oregon HIV, STD, and TB section is seeking CBO partners with experience working with populations at risk of HIV, sexually transmitted infections, and/or tuberculosis. Eligible activities for this funding include 1, providing outreach services, which support local public health activities aimed at preventing HIV, STI, and TB in Oregon, and in ensuring people with these conditions and their contacts have access to health education, testing, and treatment services. 2, assisting people with accessing HIV and STI testing. CBOs with a CLIA certificate of waiver and at least 2 years of experience providing rapid HIV, STI testing, and familiarity with state reporting requirements may be eligible to use these grant funds to provide HIV and STI testing. 3, increasing community understanding of the importance of sexual and reproductive health and prenatal care. 4, providing harm reduction and risk reduction services, such as condoms and sterile injection supplies, to the community. 5, providing supportive services to people engaged in treatment for TB or STI to ensure treatment completion. 6, and conducting medical provider education and clinical systems change to support HIV, STI prevention, care, and treatment, among other activities. Please note that specific activities will be developed and defined in the CBO's approved work plan. No broad scope activities, such as those directed to the general public, are allowed with this funding. And a letter of support from the LPHA for the jurisdiction where grant activities will occur is required to facilitate coordination and prevent duplication of work. Thanks in advance for your interest. We look forward to hearing from you. I'll pass it on to the next speaker.
Thank you, Jillian. Hi, everyone. I'm Nora Zimmerman, and on behalf of the Immunization Program, we're so glad to have you here today to learn more about health equity grant opportunities for immunization projects. The Immunization Program's focus is on reducing vaccine preventable diseases across the state. To do this, we partner with healthcare providers, local public health departments, immunization coalitions, and community-based organizations, and we anticipate funding up to 40 CBOs through this initiative with awards ranging from $25,000 to $250,000. As public health professionals, the Immunization Program's mission is to help improve the quality of life for all Oregonians. We do that by preventing and reducing the spread of vaccine-preventable diseases through immunization, managing immunization systems and services, supporting evidence-based public health practices that make a lasting impact. Next slide, please. The Immunization Program is looking for projects that are community-driven, equity-focused, especially for populations most impacted by disparities and in counties without local public health authority, and those are Curry County and Wallowa counties. We're looking for initiatives that are developed through meaningful engagement with community voices and deep understanding of vaccine hesitancy. Use culturally responsive and innovative strategies to reduce barriers to vaccination, and focus on building trust through outreach, education, and culturally responsive community engagement. Next slide, please. The Immunization Program seeks partners who have experience with immunization efforts in community settings, are trusted messengers in the communities they serve, center health equity in communities facing obstacles to vaccinations, work with local public health partners to improve and strengthen local vaccination efforts. And next slide, I'll pass it to the Commercial Tobacco Prevention Program. Thank you.
Yeah, thanks, Nora. Hi, everyone. Welcome. My name is Helen Kirane. I am with the Health Promotion and Chronic Disease Prevention section. That's the public health program that contributes commercial tobacco prevention funding to this grant program, and I'm so happy to be here and see you all here today. First, I'd like to define commercial tobacco so that we're all on the same page. Commercial tobacco is harmful tobacco plant or nicotine products that are mass produced and sold for profit by the tobacco companies. Tobacco that is sold by the tobacco industry, including cigarettes, vape, e-cigarettes, chewing tobacco, cigars, and other products that contain additive nicotine. addictive nicotine, excuse me. The term commercial tobacco is used to separate it from the sacred tobacco used by some American Indian, Alaskan Native communities and tribal nations in Oregon to promote physical, spiritual, emotional, and community well-being. Next slide, please. OHA is seeking to leverage community strengths and wisdom to address and dismantle the systemic root causes of commercial tobacco use that drive disparities within diverse communities. This is best accomplished through asset-based, culturally specific, community-led approaches centered in community voices and practices. Commercial tobacco-related disparities, they're very complex. They don't have a single cause or a single solution. So the purpose is really to leverage community strengths to address commercial tobacco use that drive higher rates in some communities. We are prioritizing applications that address disproportionate impact of commercial tobacco use on Black, Indigenous, and people of color communities, and those who are working with community members with intersecting identities. Next slide. The total funding available for commercial tobacco prevention is $6 million. The recommended range for grant awards is anywhere between $25,000 to $200,000 for 18 months of grant funding. And we anticipate the funding to be an estimated 30 to 45 grants. To be eligible, activities must be able to directly connect to commercial tobacco prevention and cessation and or help reduce the impacts of commercial tobacco. Some examples to consider include enhancing support for and access to culturally appropriate commercial tobacco cessation resources, or sharing information with community members about how they have been targeted by commercial tobacco industry and what they can do about it. Another example includes supporting tobacco prevention policy advocacy activities. Next slide, please. There are a few additional requirements for organizations applying for commercial tobacco prevention funding. These include being a culturally specific organization or a racial justice focused organization, or an organization primarily benefiting a community disproportionately impacted by commercial tobacco that leads with race. And I'm going to pass it over to overdose prevention. Thank you.
Hi, everyone. My name is Rebecca Garza. I use she and her pronouns, and I'm the Overdose Prevention Community Partnerships Coordinator. Next slide. So the overdose prevention team focuses on reducing substance use and overdose disparities in Oregon. Our team is dedicated to working with communities to strengthen pathways to hope, healing, and health. And so these are some examples of the things we work on. We provide data and information to better understand the overdose crisis and to better inform prevention strategies. We address the root causes of substance use. We connect people to life-saving resources like naloxone. We help communities link people to care to prevent overdoses and to help them on their treatment and recovery journeys. So that can include helping link people to resources like housing, which are critical for both prevention and recovery. We reduce stigma, especially towards people who use drugs. We train healthcare providers on best practices for pain management and making sure they are prescribing opioids correctly, and more. So for this funding opportunity, we're excited to partner with 3 community-based organizations, each funded at $125,000 to reduce overdose disparities. And these funds do come from federal grants. Next slide. So for these projects, they'll focus on serving communities who are experiencing the highest rates of overdose due to systemic inequities. Our main focus is to have projects link people to services and care. And we also really welcome projects that will meet multiple community-specific needs. So an example could be like looking like hiring a community navigator who can connect at-risk people to treatment and also educating the community about overdose prevention. Other examples could include engaging communities with culturally specific outreach about the overdose crisis, harm reduction, and addressing underlying stigma. Could include listening sessions, events, communications campaigns. We have an example of a communications campaign that was created locally on the slide. peer groups that support harm reduction and recovery, addressing other barriers that the community is experiencing that would prevent overdoses and increase access to treatment, increasing your organization's capacity. So, for example, training and development for your team and increasing community partnerships. And then one note, overdose prevention funds cannot be used for things like purchasing naloxone, drug take-back or disposal programs, or direct provision of substance use treatment programs. And I'll pass it to the next program. Thanks, everyone.
Hi, everybody. My name is Callie Nichols. I use she, her pronouns. Thank you so much for being here today and for your interest in this opportunity. I'm the Youth Engagement Coordinator with Adolescent and School Health. I'm here today to talk about our program. Next slide, please. Adolescent and School Health uplifts positive youth development work through our own programming, which includes youth sexual health, school-based health centers, school nursing, mobile and telehealth services, and our own statewide youth advisory council. Our program priorities are health equity and youth engagement. Our program helps to fund youth serving and or youth facing organizations for positive youth development or PYD related activities. Positive youth development is about youth gaining a sense of contributing something of value to society, feeling connectedness to others and to society, belief that they will have choices about their future, feelings of being positive and comfortable with their own identity. In addition to what is listed on this slide, positive youth development is about youth building strong connections and active involvement in all of the following areas: family, school training, program workplaces, communities such as sports, religious activities, cultural groups, and peer groups. Positive youth development is measured in general by examining factors such as self-efficacy, self-esteem, reliance, resilience, social connections, and caring relationships and community engagement. Next slide, please. Adolescent School Health is excited to partner with 2 to 4 youth serving organizations through this grant in amounts ranging from $20,000 to $50,000 to focus on positive youth development activities. So what does positive youth development work look like? Some eligible activities and specific examples include supporting youth-led creative workshops, trainings, sessions, and skill-building activities, such as an LGBTQIA+ youth-led community workshop, supporting youth-driven campaigns and projects, such as student-led development of a food bank and an after-school program, promoting positive connections for youth through mentoring or peer support programs. A specific example from a previous ASH partner of this activity is Push Movement, who hosts a youth skateboarding program with certified recovery navigators as mentors. Supporting youth advisory councils and youth action boards. Another specific example of a previous ASH partner is Young Roots Oregon hosts Adolescent Parent Voices Council, giving adolescent parents a voice in system and organizational care. And lastly, conducting a needs assessment with youth involvement for planning and implementation of youth engagement activities. These are just some general ideas with specific examples, but do not make up all of the possible opportunities for youth development activities. Thank you for your time. I'll pass it to the next program.
Hello, everyone. Thanks so much for being here today. My name is Jessica Hua. I use she and her pronouns, and I am with the Environmental Public Health section. Next slide, please. The Environmental Public Health section is looking for proposals that strengthen community-based efforts to address health risks related to climate and environmental hazards. Some hazard areas can include addressing respiratory health impacts from wildfire smoke and air pollution, for example, asthma, preventing heat-related illnesses during extreme heat events, reducing climate mental health impacts, especially among youth, addressing community health risks related to water security, such as quality and access, limiting exposure to pesticides, pollution, and harmful chemicals, cultivating the health and wellness connections with community alongside cultural and natural resources, or it could be a combination of these and other environmental challenges that most impact your community. These disproportionately impact certain communities due to historical and contemporary injustices. Health risks tend to be greater for communities that have had lower access to resources such as parks, trees, pedestrian safety, and pollution controls. Many communities have not been involved in decision-making processes or have even been targeted by policies that create unhealthy living environments. We are offering a funding range of $75K to $300K and looking to fund 20 to 40 CBOs. Next slide, please. This program offers resources to build your organization's capacity and carry out projects to protect community from climate change impacts. There's a wide variety of what this can look like, and a few examples include creating culturally community-centered educational materials. This can look like strengthening community access to shared green spaces through bicycle workshops and community gardening, co-creating wellness programming alongside climate-adapted community spaces. This can look like creating land-based trainings for youth, holding peer discussion spaces, or incorporating storytelling to shine the light on how wildfire, extreme heat, and drought has impacted community. Can strengthen networks with community members, groups, and decision makers, which may look like coalition building and celebrating community events. Next slide, please. I'll also be sharing a little bit about PEACH, which is preventing environmental exposures for children's health. Next slide, please. PEACH is a funding opportunity for 2 grants of $87,500 each. The Preventing Environmental Exposure for Children's Health is a part of OHA Toxics program, which works to prevent exposures to harmful chemicals in communities across Oregon. Because we know that children are uniquely susceptible to harmful chemicals, we developed PEACH. Some of the ways that children can be exposed to harmful substances include industrial pollution, poor air and water quality, unsafe housing or recreation environments, contaminated food or garden soil, and pesticides. Children are more impacted by these harmful exposures than adults. Their growing bodies are developmentally susceptible, and they breathe more air, drink more water, and eat more food per pound of body weight than adults. Children's bodies may not be able to break down and get rid of harmful chemicals as quickly or efficiently, and they are also more likely to put things like their own hands or toys in their mouths. PEACH's mission is to reduce exposures for children living in Oregon communities that are most impacted by environmental problems. Next slide, please. So what does children's exposure prevention work look like? If you teach kids and families about health hazards or help your community access resources to protect their soil, air, or water quality, you're already doing exposure prevention work. If you're lifting up community voice and priorities about environmental health issues, you are doing exposure prevention work. This grant offers resources to build your organization's capacity and carry out community-driven projects that protect children's health. PEACH is unique because it offers an opportunity to collaborate directly with OHA staff and receive technical assistance from subject matter experts in various areas like program development, evaluation, toxicology, risk communication, and support in developing education and communication materials or curriculum. Our most recent PEACH grantee took a multi-pronged approach to exposure prevention and completed several projects, including holding focus groups to learn about community views on toxics in the home and organizing various community events to raise awareness of local environmental issues. In conclusion, children can be negatively affected by a wide variety of environmental hazards, so there are many different kinds of impactful exposure prevention work. Please feel free to email us with any questions, and we're looking forward to your ideas and working together. Thanks so much, and I'll pass the mic to the next program.
Thanks, Jessica. Hi, everyone. My name is Sasha Reddy. I use she, her pronouns, and I support the Lower Umatilla Basin Groundwater Management Area Domestic Wells Project. Next slide, please. Community members with a private well in parts of Morrow and Umatilla County, designated as the Lower Umatilla Basin Groundwater Management Area, LUPGWAMA, can access free well water testing for high levels of nitrate. which is 10 milligrams per liter or higher, and may qualify for free resources to safe water to drink and cook with. Next slide, please. The concern. So people can become exposed to nitrate when they use contaminated well water for drinking and cooking. Formula-fed babies and anyone who is pregnant may be harmed from even short-term exposures. And everyone may experience harm from long-term exposures. Levels of nitrate at 10 milligrams per liter or more, which cannot be seen, smelled, or tasted, is harmful. Next slide, please. So what does this look like for our community-based organizations? So to be part of this project, we are requiring our CBO partners to participate in outreach and engagement work group with OHA and other partners. We are co-creating materials and hoping that you all bring community voice, which are the concerns and ideas, to the table. Other possible activities include hosting events in the Lipguama, giving information, focus groups, tabling, and other activities to engage well users in the area. Another idea is being a systems navigator. This could be to help community members complete the application for free testing. The total funding available for the Lipguama Domestic Wells Project is $250,000. We're hoping to fund up to 5 CBOs. Thank you so much, and I'll pass it on to the next program.
Thank you, Sasha. Hello, everyone. Thank you for joining us. My name is Nathan Norris. I'm a community engagement coordinator with the community engagement team. Today, I will be talking on community resilience, the community connection and empowerment. As we mentioned earlier in the presentation, the community resilience funding category is split into 2 parts. I'll be speaking regarding the community connection and empowerment subcategory. Next slide, please. So our communities face unique challenges that shape their priorities and needs. Challenges like access to healthcare and mental health services, food insecurity and housing instability, social isolation and economic hardship, natural disasters and health disparities. We know that a resilient community is one where people can maintain and improve well-being despite challenges and social disruptions. Our goal is to fund projects that help communities adapt to adversity and to improve health outcomes. Projects that center locally tailored solutions and local knowledge. We hope to fund around 15 to 25 CBOs for projects ranging between approximately $100,000 and $250,000. A resilient community where all residents can thrive, access essential services, and shape the systems that impact their lives. In our region, we've seen firsthand and how health disparities and social inequities limit opportunity. Our vision is about building a community where we feel connected, supported, and heard, especially those who are often left out of decision making. Next slide, please. Our goal is not just to improve health in the short term, but to build long-lasting systems that center community and lead to the long term. Sustainable change and improvements. There are several priority health outcomes that this funding will access, including increased community access to health programs, resources, and services, increased community engagement in local policy and health planning, increase access to health education, identify, prioritize, and address community and identified needs, decrease health disparities, and promote equitable distribution of care. By focusing on these health outcomes, we create long-term changes in the form of community-informed decisions about making their health, stronger social networks and trust, uplifted underserved populations, policy and public health systems changes, increased resilience in the faces of crises. Funding levels for this opportunity will be between 100,000 and 250,000. We're aiming to fund approximately 15 to 25 CBOs. Next slide, please. These activities were chosen because they reflect what the community has told us by what they need. By centering local voices and using trusted messengers, we're creating health strategies that are in alignment with community needs. Eligible activities are developing multilingual, culturally relevant health education through radio, social media, peer outreach, to create inclusive community spaces for connection and cultural exchange, expand community health workers and traditional health workers workforce to connect with residents to care and support, adapt OHA health information into culturally and linguistically responsive formats, align community efforts with local or regional community health improvement plans, CHIPS, increasing coordination efforts and shared accountability for community identified health priorities. Of course, this list is not exhaustive, and interested applicants should review the RFGA for the full list. Last, we were looking for applicants that showcase community leadership at every stage, ongoing evaluation and learning, cross-sector collaborations with local organizations, groups, and local public health partners. Thank you, and I'm going to pass the mic.
Hello, good afternoon, everybody. My name is Danielle Brown, and I work in the Health Security Preparedness and Response Program here at the Oregon Health Authority Public Health Division. Next slide, please. The Health Security Preparedness and Response Program is also known as HSPR. We're part of the Center for Public Health Practice here in the Public Health Division. Our office serves as the primary coordinating office for the state's health and medical response to disasters and public health emergencies. The field of public health emergency management is relatively new since the early 2000s, when there were some national events that occurred that highlighted the need for better emergency response coordination. In HSPR, we bring together the state public health response whenever a situation calls for it. Examples include natural disasters like wildfires, winter storms, and planning for earthquakes. There are human-caused disasters and crises that may occur, disease outbreaks and pandemics such as COVID-19 or meningitis outbreaks, and of course, other events of public health concern. Our program is not subject matter experts on every hazard, nor do we always have the resources needed, but that just highlights the need for partnerships, which is really key to our success. We work closely with many other public health division programs and other state response agencies like the American Red Cross, Oregon Department of Human Services, the Department of Environmental Quality, and more. This really helps leverage other expertise and resources that are needed. We also work closely with other national, tribal, and local response agencies like local public health authorities, tribes, the CDC at the national level. So our job is really to provide a coordinated health and medical response and to bring in all of those experts and partners to provide technical expertise. We also organize sometimes incident management teams to help support that state public health response. And that includes coordinating public information, various medical and scientific expertise, and operational support for our local health departments and hospitals. Next slide, please. The program mission for the Health Security Preparedness and Response Program is to develop public health and healthcare systems to prepare for and respond to major acute threats and emergencies that impact the health of people in Oregon. Our goals are to help Oregonians survive, recover, and thrive from public health incidents, to operationalize health equity priorities in public health crises, to utilize data and evidence-based practices in all efforts, and to strengthen the public health and healthcare community's ability to respond effectively to public health hazards. Next slide, please. And this slide talks a lot, shows emergency response capabilities. I have some examples of what those may look like. Inclusive planning and management may include providing training and support to ensure representatives from underserved populations are included in local decision-making bodies and task forces. Another example for resource equity would be helping with addressing structural barriers to access, such as transportation, digital divides, or trusted institutions, helping with planning on prioritizing resource allocations, such as personal protective equipment or PPE, vaccines, shelter, food to communities with the greatest need. Culturally and linguistically appropriate services may include assistance in ensuring public health messaging and services are accessible and tailored to diverse populations. And it may include providing interpretation and translation services. Data equity and surveillance systems could be collecting data based on income, language, disability status, geography to better understand the needs of populations, and identifying potential disparities in impact and response effectiveness during emergencies. Workforce competency includes helping train CBO partners or members in cultural humility, trauma-informed care, or anti-racism, helping to recruit from within communities being served to build trust and effectiveness. Community resilience building includes supporting efforts to examine and improve social determinants of health, such as housing, income, and education, to reduce community vulnerability before emergencies occur. And there are some other examples on the slide here. During the COVID-19 response, supporting vaccine outreach to communities with high infection and lower vaccination rates, heat wave preparedness, ensuring cooling centers are accessible to elderly, low income, and unhoused populations, wildfire evacuation planning, which may provide multilingual alerts and support for those with English as a second language. And finally, we hope to fund up to 30 applicants for $25,000 to $400,000 each in funding. I think that's my last slide. Thank you.
Thank you, Danielle. It's on to me. Hi, everyone. My name is Jessica Beltran, and I use she, her, ella pronouns. I am a community engagement coordinator, and I'm also the request for grant application lead. Thank you so much, programs, for sharing all of that information. And we have been counting down the days to share about this opportunity with you all. Regarding eligible activities, which is a slide that we're on, each funding category, so each program, has detailed descriptions and examples of the types of activities this grant can fund in the RFGA document. This slide summarizes eligible activities for all, which include outreach and education, community engagement and empowerment, data collection and community-led research, prevention initiatives, workforce and leadership development, policy and systems advocacy, collaboration, and cross-sector partnership. So please refer to the eligible activities under each funding category for more specific examples per program. Next slide, please. We also want to take a moment to give a shout out to our local public health authority partners. As we mentioned before, eliminating health inequities requires many approaches and a lot of collaboration. LPHAs are crucial in this work. As such, we encourage partnerships and alignment with your local public health authorities for this work. So please reach out to them using a contact list that we will provide on the application landing page. and a letter of support from the LPHA for your county of proposed project is strongly encouraged. If there are any LPHAs here with us today, I invite you to say hello in the chat. Next slide, please. Okay, now that you've learned about the programs and funding categories, let's get into what the application requirements are. Your application will require an upload of your or your fiscal sponsor's 501c3 determination letter so that we can verify your status. You will also have to answer questions about your organization and questions that will detail your project plan. You will also need to submit a budget proposal for that project. The budget questions are built into the platform, into the application platform. If you're applying for multiple funding categories, this has been a popular question. Yes, you can apply to multiple funding categories, but you must complete a separate set of project plan questions and corresponding budget questions for each category that you're applying for. So for example, if I'm applying to receive funds for a tobacco prevention project and an overdose prevention project, they're two different projects, I will respond to project plan questions for my tobacco prevention project, and I will fill out a budget proposal for that project. And then separately, I will answer project plan questions for my overdose prevention project and fill out a budget proposal for that project. So each program that shared today is reviewing for their perspective or for their respective funding categories. So just something to be aware of. You will need to upload 2 letters of support from entities that you've worked with. So this can be, like we mentioned, LPHAs if you collaborate on this project and get their support, other CBOs, maybe schools that you've worked with, other funders that you've worked with, etc. And we will provide a template for these letters in case you need it. Lastly, there is a form in the application portal that is called the Applicant Information and Certification Sheet that you are required to fill out and upload as well. All of this stuff is on our landing page and will be in the portal as well. We don't expect you to memorize it. So we'll have some more information and we can go on to the next slide. So for this part, I'm going to pass it over to my colleague, Neil, for a high-level demonstration of the application landing page. So we can stop sharing, and then Neil, whenever you're ready, you can take over the screen to share.
All right. Hi, Jess. Just to confirm, can you see my screen and can you hear me?
Yes and yes.
Excellent. Greetings, everyone. My name is Neil Armstrong, he, him pronouns. I'm a project manager around here, and I am your contact for technical support with this RFGA. Now, today I'm here to share with you our CBO funding main page here on the screen. And I'm going to share with you how you can register your organization to start the application process. So on my screen here is that landing page. We will be sharing you this link in some fashion. And so I want to share some of the highlights of this page. So first, when you click into it, you will see some of the primary details, including when this will close. And you will have this first button here to take you to your portal. This will be a quick way to get there. But before you do that, we do ask that you go all the way through and look at all the details that are on this page. So first, we do detail out the areas of funding, the eligibility requirements, the grant informational sessions. After this, we have a few more that you can join or tell a friend, English and in Spanish. I believe that we'll also be adding the recordings of these sessions to these, perhaps. Are we recording? Yes. If we're right? If not, from here, there is going to be budget and technical sessions. You can find the links here, as well as then when you're ready to apply, you can come to this section and look at all the available resources to download or look at. First, there is the RFGA application, as well as the clearly kind of written out organizational questions and project plan questions. The budget worksheet is an Excel worksheet that you can fill out to help you when you fill it out online, as well as a scoring rubric. Over here are the attachments that you can download and fill out in advance, as well as a template for the letters of support. And then again, another link to the portal. Finally, down here are some additional helpful links, such as the informational session slide deck from these sessions, the contact sheet to the LPHA, as well as things like how to write effective grant proposal and instructions for applying for funding in Web Grants, which is the program that the application process is in. Additionally, we will be including some video tutorials on how to help sign up as an organization, as well as to help navigate the application process. So when you've gone through all of this, at the bottom, you can join our listserv, as well as contact us anytime at this email address. And so, again, want to reference, get ready to apply. We highly recommend you download these, fill out the questions in preparation before you start filling it out. So we come here, and then I would like to share with you the start of the application portal. Now, Web Grants is a software system that is the application process for us that begins with your application, includes review, grant awarding, as well as reporting and long-term care of that. And so this will be an introduction here. There is some more information announcements. When you do sign up, you will be able to enter here, but the first step will be to click here to register. And this is the place that you can then sign up your organization. It's a two-step process. Sign up your organization. There's an approval process there, and then you can begin the application process itself. So there are steps here that you can take. The questions are available online. You can fill all this out, and then when you are done, save registration, and then you will be able to begin. So that is my presentation today. Jessica, I'd like to pass it back to you. Thank you so much, and I will stop sharing.
Thank you so much for that demo, Neil. And folks, we do have some guides, and there will be some videos as well on the website. So this is definitely introduction. So on to our next slide. Resources and tips. We'll be sharing tips and where to find resources in this last portion of our presentation. Neil did highlight some of those as well. On to the next slide, please. So here are some tips that might be helpful. Step one, read the entire RFGA. It is a lengthy document, but it has all the information that you need and many of the answers to the questions you've been asking in the chat today. Number two, ensure your project aligns with the desired health outcomes for the program that you're applying to. And so you can check out the eligible activities examples they list in that document. Step number three, ensure that you understand the minimum qualifications and submission requirements. If you're not sure if you're eligible to apply, I know a lot of you have asked for different scenarios. You can email us and we'll check. Tip number four, prep your answers on a downloaded template before you submit your answers through the application portal. This will just help you prepare. It's a tip. And we'll have those templates available on the website as well. On to the next slide, please. So unless a specific program states otherwise, these unallowable costs apply universally. So unallowable costs can include direct medical or behavioral health services. no vehicle purchases, research, and by research we mean, laboratory research, political action such as lobbying, supplanting state, local, other non-federal or other federal funds with this grant, or state covered services or replacing of said services. No capital expenditures above $5,000 per unit. If you submit for a capital expense over 5,000, we'll review it and it would need to be approved by OHA. Please refer to the fiscal guidance document. We also have a fiscal guidance document on the application landing page to reference allowable and unallowable costs per program. Next slide, please. And so resources that exist include many guides. We created an FAQ guide to address common questions that we anticipate you might have. We do encourage you to review it before reaching out via email, as you may find the answers on that document, and that could potentially save you time waiting on a response from us. Our inbox tends to get especially busy during this period. Some other guides that we have available include, like I mentioned, a web grants guide with screenshots and a recording, navigating the platform. We have that fiscal guidance document that lists unallowable and allowable expenses more in depth. We do have a video on the website on how to acquire a UEI, Unique Entity ID, if you don't already have one. We also have some links for language resources for our non-English dominant applicants. And then when it comes to templates, you can find, as previously mentioned, organization and project plan questions if you'd like to plan on those templates. And we have the scoring rubric that will be used to score your answers. We have that template that you can provide for your letter of recommendation if you'd like. We have that list of local public health authority contacts that you can reach for letters of support or to plan alignment of project activities. You are welcome to attend other informational sessions, though the presentation materials will remain the same. We also will offer open office sessions that where it will be open floor for specific application and website questions. So we'll record all of these sessions and they'll be posted on the application landing page Neil was just showing. And on to the next slide. So get ready. Here is a list of things that you can gather to get you started. You can get your letters of recommendation, find your 501c3 determination letter and number. Your number should be on the letter. Download the question templates to help you prepare. Review the FAQ guide. Watch the WebGrants platform recording. And that's a good start there. Next slide, please. These are the dates of our upcoming informational sessions. And our next one is on the 7th from 11 to 1. Oh, that's a Spanish one though. So if you want to go to another English one, that would be, sorry, let me go back. That's on the 8th, 11 to 1 as well. Okay, now we can go to the next slide. These are the dates of our upcoming open office sessions for technical questions about the application website or budget related questions that you might have. We'll drop a link in the chat to register for any of the info or open office sessions. I think I saw it earlier from Jody too, but we'll drop it again. And next slide, please. So there are many important dates on here. One that I want to highlight with you is our question period close date. So we cannot answer any questions regarding the grant opportunity after August the 6th due to contract and procurement rules. Any questions received after August 6th will receive a reply letting you know that unfortunately our answer period has closed. So please keep that date in mind and make sure that you plan accordingly because we definitely want to answer any questions that you might have. Next slide. So here is our team's contact information. This is our inbox. It is community.publichealth@ohaoregon.gov, and we'll drop that in the chat for you. So this is where you can send us questions that you might have. Again, if you don't see them on the FAQ, if they're specific to your organization, feel free to shoot us an email. And next slide. So thank you. Thank you all for being here. Thank you for your interest. We're excited and we look forward to your applications. And we're going to move into our Q&A portion for the remainder of the time. So what questions do you have? Feel free to raise your hand, use your hand feature, or drop your question in the chat. I tried to answer as many as I could along the way, but if I missed you, feel free to ask. And then Jody, I'll have you help me with the chat monitoring for these questions. Is it Reza? Is that how you say your name?
Hi, it's pronounced Raisa.
Raisa. Hi, Raisa. Thank you for being here.
Thank you for sharing all the info. I have two short questions. One, can an organization apply that is fiscally sponsored?
Absolutely. As long as your fiscal sponsor is a 501c3 organization. Yes.
Yes. I'm sorry if you probably answered that. I just got off work. And can that organization then, can they apply for their own grant as well if they're fiscally sponsoring you and you're applying for one? Someone else asked that question too.
Yeah, that's a really good question. The answer is yes. The only thing to be mindful of is that there is a cap limit amount that no organization can exceed. So that is, and that is on the RFGA, and that is something to be aware of.
Is it strategically better for the two organizations to then just work on one grant or still do two separate grants? Does it matter?
Yeah, that's hard for me to answer for you. I can't sway you in either direction. I think it depends on the project that you are proposing. Are you, both looking to do the same project, have the same objectives? Does that work for you? I can't really steer you one way or the other on that one.
Okay, awesome. And then what was my second question? It was fiscal sponsorship, and it'll come back to me. Come back around. I'll put my hand back up. Thank you.
Yes. I can't tell the order of hands. Apologies. So whoever is next, go ahead.
I think it's Chad.
All right, thank you so much. So when you mentioned that there's a prohibition against direct behavioral health services, is that only those that are billable through OHP, or does that mean all mental health services?
It is all. We cannot pay for clinical services for behavioral health.
Okay.
Thank you, Chad. Is it Laura that was next?
Hey, so this would be, we're fiscally sponsored, and this would be our first time going for like a larger state funded thing. And I've always kind of heard horror stories around like reporting requirements. Could you all talk a little bit about that? Maybe not horror stories, but it's more than what we'd be used to, I think.
Yeah. So our reporting, we tend to do quarterly reporting for activity and expense reports. So if you have a fiscal sponsor, ultimately, it depends on what your agreement is. You're probably the one doing the activities. So you just, have to coordinate with them on how you're submitting your reports. But we've worked really hard to try to set up a low burden reporting system The dates that we anticipate we'd be asking for reports are listed on the RFGA as well. So I'll show you all those dates and reports that we'll ask for. And we tend to give, we give a month in advance. So if we take longer to send you a reminder about it, then we'll have it be due later. But our best practice is to give you a month reminder about your upcoming report.
Thanks.
No problem. And I think it was Chelsea.
Thanks, Jessica. Really appreciate the opportunity to ask questions here too. Forgive me, I don't think my question is the same as Chad's, but I might be mistaken. For Rebecca with the overdose prevention, I understand that there are restrictions. We can't use funds to fund naloxone or do take back or disposal. And then there was mention of direct treatment, and I just wasn't sure what that entails.
That's a good question. So the funding is to link people to treatment, not to provide the treatment.
Okay.
So for example, helping someone sign up for care or navigate the treatment system.
Gotcha. Okay. And we have a component for our harm reduction program where we offer trainings, free community trainings. Is that permissible under that?
Absolutely. That is wonderful. That's a great example activity.
Okay, great. Thank you for that. And then I just had one second question, and it's for Nathan for the connection and empowerment. You mentioned 15 to 25 nonprofits or CBOs getting awarded a range of 100 to 250,000. Is that each, or that's the total bucket of money that's available?
That's each.
That's each. Okay, excellent. Thank you. I'm out of questions.
Awesome. Sorry, everyone. I wish these hands had numbers on them. I think was it Jennifer or was it Genevieve?
My end, it looks like Raisa is first, and then Jennifer, and then Genevieve.
Thank you, Jasilia. Go for it, Raisa.
Oh no, I'm sorry. I put my hand up again on accident. I didn't figure the second question out. I'll be back.
I thought the question came back to you.
Come back. I'll be back then. I'll be back. Sorry.
That's okay. Okay, next person. Jennifer, you're on mute. Sorry, I can't hear you. You're not on mute, but I can't hear you either way. No, it's not. No sound. So sorry. Do you want to plug it in the chat? Okay. Genevieve, go ahead.
Hi, I saw in the RFP that folks can possibly extend this beyond this award period, and like y'all are talking about long-term kind of relationship building. I work with a couple organizations, and one of them actually two of them are recipients of current grants in this previous cycle. Is this the opportunity to extend that work, correct? Like if we're currently in good standing, and we'd like to continue the project, we apply in this cycle and hopefully get to continue building this relationship.
To clarify, sorry, yes and no. This is a brand new opportunity. You might already have done projects that aligns with this work. But either way, our currently funded public health equity grantees, their funds end in December. And so if they didn't reapply for this grant, and if they didn't get selected, then there are no more funds. So that's why we said in the beginning, if you're a current grantee, then you still need to reapply. You still need to go through the selection process for us to be equitable to everyone applying. And if you are selected, then you are awarded. So when we do receive, if we ever do receive additional funds and there's an opportunity to extend, then we have really been pushing to do that. An example is our current grantees. Their grant was supposed to end in the summer, and we were fortunately able to do an extension that took their work through December. And so this is an example, but again, everyone needs to reapply for this grant and be selected to be awarded. So,
And a follow-up question I guess I have is
yeah.
there a preference for like brand new projects, or if what we've been doing is working and it's getting traction and it's like, wow, another year and a half would, especially in these trying times, keep the ground under us to keep moving forward. Is there a preference for like brand new things, or is it kind of okay to just try to continue the stuff we've been doing that's been working?
Yeah, thank you for that question. I can't really speak to a preference. I think if you submit a strong project that is in alignment with the priority health outcomes and do a good job of illustrating how it is that you're going to achieve those outcomes and what your activities are, then that sounds like a solid application. So don't really want to sway you either way regarding doing a completely new project or continuing what you're already doing. That's ultimately up to your organization and what you all feel like you want to do.
Thank you.
No problem.
Jennifer's next. Her sound got fixed, we think.
Yay! Hi,
Here we
Jennifer.
go.
Hi, can you hear me now?
Yes.
Yay. Okay. My question is there a limit to how many categories an organization can apply in?
Thank you for that. There isn't a limit. There's a limit of funding overall. Like no organization, I want to say it's 750,000. No one can exceed that award amount in a combined project situation. And so you can refer to the RFGA. It will have that number on there, as well as each program has their own caps, and then there's that overall that you can't exceed as an organization.
Okay. Thank you so much. Appreciate it.
Yeah.
And Cyrita is next.
Thank you.
Hi, just checking my audio. Can you hear me?
Perfectly.
Okay. So I was just wondering, I think this happened with us this year. We got some funding and it was supposed to be until July, and then we got an amendment, additional funding, and so it took it through December. This round of funding, it says it would be awarded in January. So does the project have to be completed by June 30th, or will this be for all of 2026 calendar year?
So right now we can only plan till June 30th, and if we receive additional funds, then we would go through the same process, but we're going to tell you to plan for the amount of months that we indicate in the RFP.
Got it. Perfect. Thank you.
No problem.
Christy Reese. That was an error, so I'm going to take my hand down. Woohoo, you just gave us some time back. Thanks. Sarah Anderson is next.
Hello, either way, Christy. Hi, Sarah.
Hello. Hi. I'm wondering if you could please define what's meant by a health system. I'm asking because some hospitals have foundations that are 501c3 foundations as the organization. I'm from the Oregon Office of Rural Health, based at Oregon Health and Science University. And so I'm trying to figure out the complication around eligibility there.
Yeah, and this is a really hard one, Sarah. And I think ultimately for any organization that's in this scenario, I'm gonna have to have you email me so that I can poke around a little bit more and give you accurate information. So very generally speaking, if like a clinic has a 501c3 branch and it's that branch that is applying, they're eligible. But again, I need to hear a little bit more about your specific situation, and I'm happy to forward that question over to Office of Contracts and Procurement. And if we need to modify any language in our RFGA to be a little bit more clear, then you sending us that question and your information can help us. So I will have to owe you an answer on that one, Chelsea.
Thank you so much.
Oh, sorry, it was Sarah. No problem.
Stephanie McClure's up next.
Hi there. Thank you so much. I am wondering if you can provide some more clarity around the funding stream partially coming from the federal government. And I just saw in the documents that I was reviewing that you all can be audited by the federal government for these grants, so they have to comply. For anyone who's doing like culturally responsive work, I'm curious if it's worthwhile to even submit an application or if it would be seen as DEI related work and automatically, because of federal things that are happening, seen as not allowable and potentially find ourselves in a situation where funding is rescinded. I think many of us have been through that situation already this year.
I hear that, Stephanie, and I feel that, and I feel for you deeply.
Thank you.
And it's kind of hard for us to say, right? Because we find ourselves in a time where none of us really know what's going to happen, and all we can do is plan and hope for the best. Our grant model is a mixture to make this have the various different programs. It is a mixture of state and federal funds. So it would be deceiving you if I told you that I know what's going to happen tomorrow and what the possibilities are, because simply we just don't find ourselves in that time. We are planning and hoping that there will be no issue with the funds, and that's all we can really do on this end.
If I could just a follow-up to that, is OHA planning to see like for specifically culturally responsive applications that you are wanting to see and wanting to come through? Is OHA planning specifically to only use state funding to fund those programs so that in case that does happen on the federal side, those programs don't find themselves in the same position that we have this year with other mixed funding grants?
It depends on the program, and I want to say our RFGA should indicate where those, it does not. Okay. Let me follow up on that, because there are some programs that we know are state funds and some that we know are federal. I think some of them mentioned during their presentation that they are federal funds. And that's all we can really, there's nothing else that we can really do, Stephanie. And this grant is meant to be a culturally specific grant. That's our, it's a public health equity grant. That's our purpose. And that's what we live and get up for work for every day.
Yeah, don't feel like you have to water it down with us. Like, this is why this grant exists. We want to fund like these culturally specific, unique programs and activities that you have. So please bring it on.
Talicia would be next.
Hello, thank you so much for this info session. It's really, really helpful. So I have a couple questions. One is, so I was a little unclear about if you will fund a culturally specific like health clinic, drop-in health clinic, because you mentioned that you were not going to provide direct access services. So this clinic would basically focus on education and prevention. The second question is, who's on your selection committee? How are they chosen? Are they folks who are represented around the state, or are they primarily in Portland? Like, who makes up that selection committee? Thanks. And you already asked my question about reporting that I put in the chat, so thank you so much.
Hi, Talisha. I'm so sorry. What was the first part of your question?
The first part was, do you fund for culturally specific clinics? Yeah, drop-in health clinics that focus on education, prevention.
I feel like I need to hear a little bit more about what that entails. So we do fund outreach and education type of projects. So
Okay.
if you're first off, it would be FQHC, or again, you have to have a 501c3, and your
Yes.
project is to provide outreach and education in this specific subject matter. That is an allowable activity. And I encourage you to look at what program specifically you're looking to apply for, what that outreach and education is, and look at their eligible activities and ensure that that's in alignment as well. So
Okay.
did that answer your question?
It does somewhat vaguely, so I'll dig in a little bit more to the RFG. So, and then the second question about your selection committee. And if I'm unclear, I will definitely send out an email.
Sounds good. So yes to outreach and education. If it was like you're providing a clinical service, most programs don't. And if they did, it would be in the eligible activities. So that's why I'm trying to make that vague answer because of that distinction.
Okay, so outreach and education, yes. Clinical services, no. Okay, that sounds really clear to me.
For most programs, and I think the exception's going to be immunization here. But again, I really encourage you to look at their eligible activities.
Gotcha. Thank you.
No problem. Regarding review, so I mentioned earlier that programs will be the ones reviewing. So it's program staff that will be reviewing for the projects that you propose for that respective program. So it's that program team. And then we also do invite LPHAs to be part of reviews as well. And this is a statewide offer to the LPHAs that we work with. So they are part of the review committee for our modernization programs, which are environmental public health, what is communicable disease, and health security preparedness and response.
Wonderful. Thank you so much. Appreciate that.
No problem.
Phil's going to be next.
Hello, thank you, OHA staff, for a wonderful session. My first time participating. We run a small nonprofit in Southern Oregon called Life Art. My question's for Kelly Nichols concerning youth engagement. We're working with very at-risk youth who are typically undocumented in schools. 75% of our population is Latinx, and that we serve. And the question is on reporting specifically. When reporting is in question, will we be required to provide names or any identifiable information for the youth we serve? Thank you.
Thank you for your question. We would not require any identifying information in regards to the youth that you're working with.
And Raisha?
Hi.
Hey.
Thank you. So, my question is, for newer organizations, is there any like housekeeping or tips that you could share that have been helpful for those organizations that have been awarded, that they've done to make their applications stronger as they're newer? They don't have like some of the same connections or, longer history of projects completed, to show like that they can complete the job, or to prove that the viability of their project. Is there anything that's shown in the past that's worked?
Thank you for that question. I think the best advice we can give, and we're going to repeat this a lot, is just ensure that you look at the priority health outcomes for the program that you're applying for and the eligible activities, to be able to make your case on how your project and your activities align and will result in those health outcomes. So that's my best advice to you. And also, again, we do make a rubric available for that reason. So when you talk about experience, I think you can talk about transferable skills wherever it is that you lack the experience. And again, be able to tell that story of how it is that that skill set that you have can still help you succeed despite the lack of experience.
Awesome. Thank you.
No problem.
Amy's going to be next.
Yeah, thank you so much for this presentation. I've seen a couple times in the chat where a couple organizations are saying that they serve multiple counties or are statewide. And I think because a couple of the programs seem to require letters of support from local LP or from LPHAs, what are there specific programs that would be not well suited to a statewide organization, or should the project be like just for like a couple counties, or do we really need to get LPHA letters from every single county in the state if we're serving statewide and doing the work statewide?
That is a great question. Amy, for your work, if you're based in one county and you are really doing multiple programming in County B and County C, even though you might serve counties D, E, and F, but the majority of your programming is in County B and C, even though you live in County A, it would probably show a good strength to get a letter of support from a county that you are heavily doing work in, but that you may not have boots on the ground in, right? Because that would show to anybody reviewing your application that even though this person isn't based there, they have a very strong connection there and they've built out their programming there to the point where this LPHA can provide a letter of support to speak to that.
Okay, thank you.
Brittany's going to be next.
Hi, yeah, thanks so much for hosting this session. It's been really helpful. I'm understanding that this RFGA cannot fund direct clinical behavioral health services. I'm just wondering if it would support like peer-led groups and activities that are not otherwise billable, even if they are part of our, say, substance use recovery program or HIV services program.
To me, that sounds like prevention and education. And that is well aligned, especially because you're speaking to HIV. What program are you, or like what projects would you be speaking to, like for these circles? Is this general?
No, so we have a couple of programs that we're recently developing specifically within our, we've been piloting like an equine wellness program within our substance use recovery participants, and we want to maybe extend it to our HIV services community members. However, they aren't billable services, so that's something that we would be interested in applying for.
Yes, then that would be in alignment. I would encourage you to, especially for the communicable disease prevention category, to like really look through that RFGA section of eligible activities, because I think they call out that those types of like education and prevention services have to be tailored for the community that is experiencing that or at risk for that, not just general populations. And so yes, I would say that would be in alignment, but please do double check and read the RFGA section for that.
Thank you.
Bing will be next.
Thank you for this very informative session here. This question has been asked a couple times in the chat. If I missed the answer, apologize ahead of time. This is really, I'm curious about the 2 letter of support requirement. Is that a per area focus program we submit, or is it in total?
It's just total. It's just total. We just need to.
Okay, so we can, if we are going to apply for like a multiple focus areas, and we can use the same 2 letter of support as the part of the application.
Correct. So there'll be, once you get into the application dashboard, you'll just see a link for you to upload letter 1 and letter 2, and that's it. You're done. That part is pretty straightforward. So just to, oh my goodness, if someone got a letter of support for every program area that they were applying to, that would be very remarkable, I would say. But for this grant opportunity, just 2.
Great, thank you.
And Maureen?
Somebody had put this in the chat, and it's a good question, so I wanted to
highlight it, and sorry if you've answered. This is a lot of info, which is great. Can CBO coalitions apply for funding? And if so, can they apply separately and as a coalition? So like if one org decides to be a fiscal sponsor for the coalition, would they then be able to also apply as an individual organization?
Yes. The only thing is to be mindful of that cap not to exceed for any organization.
Okay.
And it is listed on the RFGA.
Okay. Thanks.
No problem.
Jeannie has her hand up.
Hi. Just a clarification. Can you hear me? Thanks. For the not funding clinical mental health or behavioral health resources, our organization does peer like girls empowerment groups where it's not clinical mental health services, but it is kind of that social emotional learning and building self-efficacy among them. And some are specialized for BIPOC youth, some are specialized for LGBTQIA youth. Is that like on the borderline of what you would consider direct services, or is that allowable?
Yeah, I would say peer support groups, if they're allowable for that program, it's gonna have that in the eligible activity.
Okay.
Did you have one specifically in mind? Maybe we can ask the program
Well,
member.
we've done adolescent school health in the past. We're looking at tobacco prevention. We've done it through there as well. And some of the newer ones like that have mentioned youth mental health in the RFP, where it can't be like our therapist providing individual therapy. I
Yeah.
get that, but we do a whole bunch of like after school activities that we kind of book in that. And then we also have therapy groups that aren't actually run by our therapists. So there's kind of this gray area, and I want to make sure that we're in there and correct when applying.
Yeah. I wonder, Kelly, might you have an answer for this, or maybe we can take the question back if you don't?
Yeah, similar to what you had stated, Jessica, if it's like a peer support group, that was an allowable expense under our program. And it's actually a listed proposed activity.
Thank you very much. I appreciate it.
No problem.
Yay. Thank you, Kelly.
Robin, go ahead.
Hey, yeah, I'm just reviewing the RFP right now, and seeing a line here that school-based health centers are not eligible to apply for these funds under the adolescent and school health program area, because they are government agencies. And could you clarify? That's a little confusing. I do work for a nonprofit, and a CBO that runs the school-based health center I manage.
Yeah, thank you, Robin. I
Yeah.
agree, that is confusing. I would also like to tap Kelly for this question because I think that she will be much more of a expert on this than myself.
Yeah, thank you. I would love if you could follow up that question via email and I could get back to you. I just want to reference exactly what's listed in the RFGA because I'm not sure. And then want to just know the specifics and take it back to my team if that's okay.
Yeah, sure. I'll do that. Thanks.
Thank you, Robin. You can use that CET email we showed earlier, and we can plug it here if you don't have it.
Yeah, could you just drop it here? That'd be quicker for
Yeah,
me. Thank
sure.
you.
Lily's next.
Hi, this is so awesome. Thank you. I had a question, and it seems like someone else has the same question, so I thought I would ask. It's in the chat. It's so we have additional OHA funding related to our commercial tobacco work, and it's different, pretty much. It's different funding source. So we're working with those folks. Can we ask them for a letter of support, or is that weird? Or if it's weird, is it still okay? I mean, weird is fine, but is it bad weird?
I haven't had this question before, and it's such a good question. I don't see why not. Cecilia, do you have any thoughts? Do we need to ask more about this?
Can you repeat the question? I was answering another one in the chat. I do
Yes.
apologize.
And I can help too. So they work with another program within the state, and so wondering if the letter of recommendation can be from that program or that division for our required letters of recommendation, or if we want them to be external.
That is a good question. Like a letter coming from a program at OHA or a program at your LPHA.
It would be through, well, I don't know if they would say yes. So I'm not assuming they would, but our work is through Health Promotion and Chronic Disease Prevention on a CDC grant they have. And we like working with them. We would be excited to ask them for one. What they said, I don't know if they'd say yes or not, but today we would plan on emailing them and asking if they felt okay doing that. If y'all said we could do that. Anyway.
I feel like it might be slight conflicts of interest, to be honest, Lily. It sounds like you all do great work, though. So if there's any like LPHA partner or CBO that can vouch for your work, that would probably be a good place to get that letter from.
If we're done answering all the hands raised. Oh, no,
Yeah,
Julia has one.
Julia Brown.
Thanks. Hi, everybody. I'm just going to go ahead and ask the question that I just put in the chat because I see that the chat is just bonkers. I'm wondering if we can subcontract with a university or a community college.
That is another question I think I will have to owe you, Julia.
Okay, Jessica.
Apologies, but please email it. Folks, in case you missed it in the chat, those answers aren't just for the people that ask. We actually publish them and update our frequently asked question guide with any new question that's not on there and response. So everybody will have access to those answers.
You've got Michael.
Yeah, can you hear me?
Yes.
Yes. Okay. On top of that question, other than not allowing clinical research, is there other type of research that is allowed, specifically as it relates to in connection with community-based organization, if universities or community colleges are allowed to work with them?
Michael, I think it would be great to know a little bit more about what you're thinking. Is it similar to this question about subcontracting with a school to do research, or is it more of like you're collaborating with the school? I think those details and nuances might be able to help guide us with what that correct answer is for you.
Okay, maybe just the types of research that would be allowed through this, regardless of if there is a university attached to it.
Yeah. So again, each program and their eligible activities will list things like if there's like surveys that you're taking, like a survey for a specific community group, or intakes that you're doing. So those types of things are listed there. And also in the budget guidance document, it talks a little bit more about unallowable and allowables. And so that should give you some helpful information as well. So I think when we talk about like community research, a lot of it entails surveys, and I know that there's other examples that I'm failing to remember right now, but that type of activity is allowable. Community assessments. Yes, that's the word that I couldn't think about. Thanks, Alyssa, for helping me with that one.
I see a question in the chat. I'll read it out loud. Are applicants allowed to apply to multiple program areas within the same application cycle? Given the scope of work, we see alignment across several categories and would like to clarify if multi-program proposals are encouraged or if we should prioritize just one. That's a great question. For this funding cycle, you will see that there are some categories that kind of naturally lend themselves, for example, to have overlap, like for example, climate and health and community resilience. I want to say that if you are applying to this funding opportunity and it does have a little bit of overlap, to really, like if you're choosing climate and health, to really highlight those climate and health things. And if you want to pull in components of community resilience, to like do that, but really make it very clear which one you're applying for. If you were to do the same with the community resilience one, really clearly outline how it is community resilience related. And then, you can say the overlap as well. But these applications will go to the different areas for review. Hopefully that answers that first question. Is there a preference or scoring advantage given to collaborative partnerships over standalone applicants? While we are open to both, we would like to understand how OHA evaluates applications in this regard. That's another great question. I won't say that it's a scoring advantage. If you apply as a standalone or if you have partners, like we do love to see partnerships, but you don't lose points if you're applying as a standalone organization. And I'll pass it to Jessica if she has anything to add to either of those questions.
I don't have anything to add. Thank you, Jasilia, for helping.
I see more questions in the chat. And then I've collected quite a few, and it looks like a lot of them were answered from earlier. But I apologize for if not, and they will be answered in the FAQ. So the question about community assessments, what about community participatory action research? It looks like Jessica did answer that in the chat now. And we'll have to follow up on that. As an organization going for multiple funding buckets, are we able to copy and paste responses to some questions where answers would not be meaningfully different between different programs? I assume that would be okay. Unless Jessica or Julia have a different opinion about it.
I would just say just to be mindful that you are still speaking because each program's priority health outcomes might differ. And so in copying and pasting, I would just suggest that you be cautious and ensure that you are responding and speaking to the priority health outcomes for that project. And so that might be a risk if you're copying and pasting. So that's just something to pay attention to in kind of copying and pasting your answers. But we do provide that template for you to plan those answers as well. So that might be helpful for you. Again, pay attention to what the rubric is asking and pay attention to those priority health outcomes for each program. Again, tobacco won't necessarily speak to environmental public health about your projects that you propose to each and see alignment there. So just be mindful of that and don't think that one project is going to know what is on your other proposal. So that's the only risk with copying and pasting, making sure that you're speaking to that project and that program.
Rachel has a question.
Yeah, and I'm sorry I haven't looked at the RFGA yet, but will it be the same set of questions for each program area? You'll just be responding based on the project that you're applying for?
Exactly.
Okay, thank you.
No problem.
Genevieve is next.
I had a question potentially directly for Danielle if she's still on the call. But with the emergency response and resilience, I was curious how into preparedness can we go? I do a lot of work in like food systems, and so supporting local food systems feels to me like a really important piece of preparedness to disasters because food being closer. But I just was wondering if like are your funding priorities really about like kind of mass care situations and co-ed style work?
Genevieve, it looks like Danielle had to step away. I mean, I agree. I think food is very important and it's part of emergency preparedness. I would encourage you still to look at the RFGA and really see how your programming aligns with what they have established as activities they're looking to fund, though. That part is really, really important because you may find that the work you do may fall in a different funding category that you did not expect. So please just double check, read through all of the categories that you think it might apply to, and then align it that way.
Tamara is next.
First, thank you for doing this informational section. It was very helpful and still is. I guess my question is, if you're applying for your grant for multiple areas, in one area you don't get it, are you still able to get it in a different area? So you might not get any funding for the school portion of it, but then we might get it for emergency management. Is that possible? Or if you get knocked down from one, you get knocked down from all of them?
That's a great question. So no, if you apply for multiple categories and you are selected from out of like two out of the three that you apply for, then you're selected for two out of the three. Your whole application doesn't get knocked down if you don't get selected for all three.
Okay.
Yeah.
Last question. So let's just say you apply for 100,000, then can you guys come back and be like, hey, we liked your grant. We don't want to offer you 100,000, but we'll offer you 25,000 or something like that. Do you do that?
Yes, we do. We do. Hmm.
Thank you.
It wouldn't be the same without Raisa asking a question. You're next, Raisa.
Hi guys. Okay. So now I'm getting a little confused with the multiple category grant submission. How does that work as far as the submission on the site? Are you doing individual grant submissions or is it one full are you writing like the actual writing of the grant? Are you writing out the full grant to support the two, like say you do two categories, or are you writing separate grant proposals for each category and doing individual submissions?
Another great question. Once you start your web grant, so the web grants is the application portal. You will answer some initial questions, like background questions about your organization, your mission, your purpose, and all that. Once that is submitted to us, someone will approve and send you your login information. And then from there, you will be able to go in and select which program you want to apply to, and you will submit your project questions. You'll answer project questions, and you will provide a budget. So that's where it will differ. So if you're interested in applying for two separate program areas, you will have to provide answer questions about your project plan and budget for each of the ones that you're applying to. Does that help?
Yes, thank you, Ms. Cecilia.
Good, no problem. Go for it, Michael.
Michael?
Thanks. I'm just wondering how the funds will be distributed across the state. Are these applications being solely scored off of their the points, or let's say if a certain part of the state has a lack of funding awarded or grants awarded, but their point value is lower than another one, and the other one is in a part of the state that has a lot of awarded grants based off the population. How do you guys foresee making sure that the funds and grants will be equitably distributed across different regions of the state?
That's a great question. We do have a formula for us to look at all of the grants and try our best to ensure that we have a pretty good distribution all over the state. We don't hit the mark every time, and sometimes it's really difficult to do that. And we have plans in place for if we don't receive applications from a certain county, what to do, and how to support that area. But yes, that is something that we do keep in consideration, and we try our best to have a distribution all over the state.
Okay, thank you. And then just a follow-up question on that. If a certain part of the state gets underfunded or awarded, will you withhold funds or extinguish all the funds and awards, being that if you withhold funds, you're looking for, you'd put the opportunity out for specific areas. I'm just kind of, curious just in case a certain location doesn't get properly awarded right away, if there's an ability for them to at a later date.
Yeah, it's a really great question. And we do have like contingency plans in place to work with LPHA partners when that happens, just to try to ensure that there is coverage throughout the state. So hopefully that answers your question.
No, I appreciate that. Thank you.
Tamara?
I really like that question, Michael, because I think I'm bringing it up because some people have like professional grant writers and some people don't. So the grants might not be equal. So do y'all pay attention? So if somebody has, like, if you're reading their grant, like, this is great work, it might not look as good as some of the people who have professional grant writers. So do y'all take that into consideration and be like, you know what, we see the work that you're doing within this and how you explained it, and we can give you funding, even though it might not have like the professional wording as a professional grant writer?
Yeah, of course. Like for our last grant, for all of the grant cycles actually to date, we've put our applications through an equity review. We understand that resources are not often equitably distributed, right? And so if you don't have a grant writer, that is okay. We want you to explain your project to the best of your ability, and just know that like we see you, right? That's the biggest part is to come with your best game, right? Like explain your projects, and know that on the other end we can tell, like we can tell, and we are looking for a diversity of organizations to fund through this funding opportunity, okay?
Y'all, we're coming up on time. Is there one more final question? You can always email us if you think of others.
Well, we want to thank you all for sticking it to the end. You all asked some really amazing questions. Thank you to Jessica, Jody, and Christine who were monitoring the questions and trying to answer them in the chat. And thank you to the program staff who were doing the same. Again, if questions come up for you, please feel free to email us. The landing page link that was dropped in the chat has all the resources that you can think of to help you prepare to submit a successful application. And if there's something that you find is missing, you email us and let us know. We really appreciate you taking the time to be here. Shout out to all of our LPHA folks. I see you, Jamie, just for being here today. We really appreciate you. Thank you for being partners in this work. And thank you for all the new faces and familiar faces that joined us today. We appreciate you. Please let us know if you have any questions. Again, we'll be doing a couple of more sessions of these. It will be the same and it will be recorded. So if you need to go back and reference things, you'll have that as well. So thank you so, so much for being here today. And thank you to the OHA team for being here too. We all appreciate you.
Thank you. Bye.
Thank you.
Bye.
Thank you, everyone.